We'll turn to Dr. Harvey Rische, Professor Emeritus of Epidemiology at Yale School of Public Health. He is a practicing epidemiologist with more than 40 years of research experience. Dr. Rische received the Bachelor of Science degree in Mathematics and Biology from the California Institute of Technology in 1972 and completed medical training at UC San Diego School of Medicine in 1976. And I've asked Dr. Rische to really kind of talk about the epidemiology of the pandemic and age stratified risk and how we just might have overreacted to this.
Thank you, Senator. I'm honored to be with you in the panel today. I'll keep this brief. A pandemic with relatively low mortality is not managed by counting the cases. It's managed by preventing hospitalization and mortality. And so this slide that you see now shows the breakdown, the distribution of mortality through September of last year, before Omicron, by age group. And you can see that there are almost no bars in the youngest age groups, and that's because there is almost no mortality. And the mortality that exists in those age groups is due to chronic conditions such as obesity, diabetes, chronic heart disease, chronic kidney disease, immunocompromise. Almost entirely in those age groups, and even in the older age groups, the mortality is among people who have multiple chronic conditions. But the point of this is that when you have such low or non-existent mortality in these low age groups, the potential serious adverse effects of the vaccine will surmount the non-existent mortality of these age groups. And therefore, what we've been told, that everybody has to be vaccinated, that all these approvals for the vaccines that have pushed their way down into the youngest age groups had no reason to be there in the first place because there was no mortality that they were trying to prevent. We already know that the vaccines don't prevent spread, as the CDC said on August 11th. They don't prevent transmission, so the only point of them is for personal protection as treatment if one wants to choose that. And yet there's no reason to choose that when the mortality from the infection is orders of magnitude less than it would be from the vaccine. And that's what this chart shows.
So real quick to look at the numbers, standard flu season has what level of mortality compared to, again, you've got 0 to 17, 0.01, 18 to 29, 0.05, 30 to 39, 0.15. What's the standard flu season?
It's comparable to this. Approximately plus or minus.
Okay, so kind of like flu, pretty deadly if you're pretty old or if you have different comorbidities.
Correct.